Symptom management in patients with terminal diseases, improving and sustaining high-quality outcomes in acute care. How can we effectively measure the outcomes associated with symptom management in patients with terminal diseases in the acute care setting? Data that alerts professionals concerned with quality improvement to the presence of a problem is the same data that can be used to determine the impact of efforts to reduce the problem. Data can be collected from internal or external sources. External data is new information from an outside source. Internal data, collected from within the organization, is used to support the need for change. In this case, data from patient-reported symptom management in the acute care setting was used to support the need for quality improvement. This presentation will discuss the outcome measures and professional development opportunity and outline a strategy plan to improve symptom management in patients with terminal diseases in the acute care setting. Our organization is a single hospital within a large health system. We are a 749-bed facility that delivers care to diverse populations with complex acute and critical needs. We were awarded magnet status in 2004 and currently have a nursing staff comprised of 94% bachelor's degree holding professionals. Hospitals with a higher percentage of bachelor's prepared nurses have a reduced incidence of preventable injuries toward patients and higher positive patient outcomes. Our hospital has been recognized for excellence in cardiovascular care by the American Heart Association annually since 2013. It also ranks number 3 in the country for orthopedic surgeries and joint replacements. Symptom management is poor in patients that present to our facility with diseases in their terminal phase. There is a common belief among nurses that pain and other symptoms will lessen as the patient heals. However, when caring for patients with diseases in their terminal phase, nurses demonstrate uncertainty, express internal conflict, and apply inappropriate and often ineffective interventions. During the last 6 months, patients that were admitted with intractable nausea or vomiting, diffuse pain and dyspnea related to diseases in their terminal phases reported a symptom control on 0 to 10 scale, with 0 being the worst management and 10 being the best management or symptoms completely resolved, a 4 on average. I believe the reasons for this organization's poor performance in symptom management in this population is lack of understanding of interventions to effectively manage the symptoms of patients during the end of life and role certainty when delivering nursing care to patients in the acute care setting with terminal diseases. Professional development improves the knowledge and skills of nurses beyond the traditional learning environment and is designed to keep nurses abreast of changes in healthcare and practice. To improve symptom management in patients with terminal diseases, the nurses in this hospital will participate in a 2-day professional development program. The Professional Development Program, End-of-Life Nursing Education Consortium, will cover the symptoms that patients experience with terminal diseases, recommended interventions for symptom management, and the nurse's role in caring for patients with terminal diseases in the acute care setting. This program is recommended for nurses that care for adults and pediatric patients in oncology, medical surgical settings, hospice, palliative care, clinics, and other facilities. In our organization, we utilize various forms of communication. Email is an asynchronous form of communication which is compatible with the various schedules that nurses work. It is frequently used between clinical managers and nurses, as nurses at all educational and skill levels are familiar with its basic functions. In addition to email, printed newsletters are distributed through the hospital, and are placed in high traffic areas like the cafeteria, elevator wells, near time clocks, and employee entrances. There are two quality programs within the organization. The first is Kaizen, a nurse-driven initiative, which supports change in practice and policy by nurses at the bedside. When a nurse recognizes an opportunity to change practice, she or he contacts the Kaizen committee, sits through an informal interview, and if approved, completes a formal proposal. The second quality improvement program is the Quality Improvement Department. This group is comprised of healthcare professionals and researchers from various backgrounds. They are responsible for identifying wide-scale quality improvement opportunities throughout the organization. The hospital is well known for its response time to emergency situations, managing chronic conditions such as renal failure, congestive obstructive pulmonary disease, and congestive heart failure, as well as orthopedic surgeries. Because of this, the culture of the organization seems focused on healing and recovery. As a hospital that appeals strongly to curative and disease management needs of patients, the organization's culture, processes, and behaviors also affect the outcome measures of patients with conditions that are incurable. In the application of Rogers change theory, internal data, patient symptom management scores, was used to identify the problem. Improving symptom management in patients with terminal diseases is in alignment with our organizational goals. The professional development program will be trialed in nurses that work in the cardiac and medical intensive care unit and two med-surg units. The ultimate decision to implement the change hospital-wide will be determined by the relationship between nursing knowledge and patient outcomes in symptom management. To determine the impact of this program on patient outcomes, baseline data will be collected. For the preceding 6 months, patients admitted with applicable terminal diseases and symptoms will rate their symptoms on a 0 to 10 scale. The diseases include congestive heart failure with class 3 symptoms on an NYHA scale, Alzheimer's disease with a FAST score of 7C or below, widespread metastatic cancer or stage 4 cancer, and renal failure, liver failure, AIDS, Parkinson's disease, congestive obstructive pulmonary disease that all meet criteria for admission to a hospice program. Assessed symptoms will include shortness of breath, intractable nausea or vomiting, and pain. After participating in a professional development program, nursing staff will take a post test. The differences in pre- and post-course scores will be used to determine if there's any change in nurses' knowledge of their role in caring for patients with terminal diseases. For 6 months after the professional development program, symptom scores will be collected from the same patient population. Combined with the nurse's post-course scores and patient symptom scores, a relationship between the nurse's knowledge and patient outcomes can be concluded upon. Our organization demonstrates its commitment to research and quality improvement within its founding statements, internal quality-oriented programs, and fostering a culture of quality and safety. We are affiliated with schools of medicine, nursing, and nurse anesthetists from well-known private universities. Annually, students enrolled in these programs are assigned clinical rotations in this organization. As a teaching hospital and provider of inpatient health services to a diverse metropolitan population, our organization facilitates a robust learning experience. Our teaching culture and relationship with academic institutions supports our ability to continually improve upon knowledge and care delivery processes. Our organization is known for its use of state-of-the-art technology, patient and family-centered culture, charity, and a system that delivers care across settings. We are driven to improve care delivery. This drive for excellence will support our efforts to sustain improvement in the management of symptoms associated with terminal diseases in the acute care setting. We are a part of the largest health system in the Midwest, and in 2015, gross revenue for the combined 6 hospitals and 187 outpatient clinics was nearly $12 million. We publish clinical practice guidelines and research in professional journals, and our medical library is often utilized by students and professionals conducting research and assignments. We have the financial and scientific resources to sustain change. Going into the future, we are an organization prepared to maintain the improvements that result from change. Our nurse leaders will act as change agents. Change agents assist people and organizations to understand why improvement needs to take place and how improvement impacts professionals and consumers. Nurse leaders will inform nurses at the bedside of the purpose of the quality initiative and how the improvement will impact their practice and patient outcomes. Nurse leaders will support and coach staff. Coaching is used to change behaviors, increase confidence and motivation, and improve leadership. They will be available to clarify concepts of the quality initiative and answer questions. They will utilize positive reinforcement and a variety of coaching methods that support the needs of nursing staff. There are 3 coaching methods: one-on-one, group, and systems. They will model and encourage the expected behaviors. It is expected that nurses will demonstrate competence in meeting the needs of patients with terminal diseases in the acute care setting. The leaders will engage nursing staff in clinical decision-making by asking open-ended questions. Leaders will imitate nursing decision-making when reviewing patient cases in a review or learning setting. The nurse leaders will also balance organizational goals with the needs of nursing staff. Effective leadership requires a passion for change and problem solving. In this organization, the nursing leaders will use these passions to support goal attainment in the organizational and professional level. Summary: patients with symptoms from terminal diseases perceive their symptoms to be poorly controlled during their hospital stay. As an institution that values quality improvement, we are required to respond to the data with the plan to improve patient outcomes. Death and dying is vaguely explored in the general training of healthcare professionals. To address this gap and improve our healthcare professionals' understanding and subsequent ability to respond to the complex needs of these patients, professional development is a viable option. The Professional Development Program on Symptom Management in Patients with Terminal Diseases explores dynamics that may impact care delivery. Beyond the disease itself, these dynamics include the patient's age and/or development, finances, living situation, and family presence. Having the knowledge of dynamics and symptom management recommendations for patients with terminal diseases prepares the nurse to meet the needs of these patients. We will evaluate the outcomes of professional development on symptom management by addressing, on a numerical scale, symptom management within its population. This action research will give us insight into the influence of ongoing education on patient outcomes. In the midst of all that we do well, we have an opportunity to improve the outcomes of a patient population, patients with terminal disease and symptoms from their condition. Thank you for supporting this quality improvement initiative.